Hello and welcome to another quick chiro presentation. Today I'm talking about the facet joints because the facet joints are the most common cause of pain in the neck and the second most common cause of pain in the lower back. So with the facet joints causing so much pain, what are they? Look up here at this man, we'll zoom in. We've got three lumbar vertebrae in the picture with two discs in between. Behind the disc is the foramen where the nerve comes out, and then behind that is the facet joint. Healthy facet joints have smooth cartilage on both sides, plenty of open space here for synovial fluid. There would be no rubbing or friction and movement with this one here. However, down at the bottom we can see quite the opposite. So this guy is going to have a lot of low back pain, correct? Not necessarily. Oftentimes the facet joints shoot pain away from the actual structure themselves. In the upper neck, it's radiating pain up into the head, base of the skull. Now down at the bottom of the neck, if that facet joint's damaged, a lot of the times we're feeling it more down into the shoulder blade. In the middle of the neck, a lot of trap pain here. So people come in and they swear that they have a tight muscle right here, that's all it is. It's really the facet joint that's causing their problem. The further down the low back that the problem is, the further down into the glute and leg that you potentially are going to be feeling this problem. If you have a bad facet joint, what do? Chiropractic or manipulation has been shown to be the most effective manual therapy if you meet certain criteria. If you've only had your symptoms for less than or equal to 16 days, if the pain isn't shooting off that far from the spine, if you have restricted motion, amongst others. Now, if you have 3 of these criteria met, you have a 68% probability of success with chiropractic. If you have 4 of these criteria met, then you have a 95% success rate with chiropractic. Outside of chiropractic, you have other options. Oral anti-inflammatory medication may help. The next step beyond that, steroidal anti-inflammatory, and inject it directly into the joint, shown here in the picture. The research here shows benefit for 6 to 9 months post-injection. Nerve ablation, where they heat up the nerve, which damages it in a way that it can't transmit the nerve pain signal. So when you look at chiropractic, the pre and post adjustment, the pre on the left, this is the facet joint shown here. If we look at it pre-adjustment, there's a certain amount of space, but post-adjustment, look at that, it's wider, there's more space there. So more space allows for more motion, more synovial fluid, less irritation, less inflammation, and it allows the body to heal over time. If you like what you saw, if you thought you learned a little bit, you'd like to know more, then just follow, subscribe, like, do all those things, and I'll see you on the next one.